What exactly are NCCI Edits? NCCI is the National Correct Coding Initiative, and it was developed by CMS, the Centers for Medicare and Medicaid Services, to promote correct coding methodologies and reduce improper coding that could potentially lead to improper claim payment on Medicare Part B services. Medicare Part B covers your physician and provider stuff, so things like your outpatient office visits or things like same-day surgery. So NCCI is designed to reduce those improper payments and identify code sets of things that shouldn't be billed correctly or shouldn't be billed over a certain number of units in a day. Essentially, it provides guidance to prevent duplicative billing and also make sure that services that are rendered are medically appropriate. There are actually two main types of NCCI edits. We have the PTP, or procedure to procedure, which are services that one procedure shouldn't be billed with the other procedure. And then there are MUEs, which are medically unlikely edits, which are services that shouldn't be billed over a certain amount. And let's kind of break these down. So procedure to procedure edits are saying that this procedure and this procedure either can never be billed together or probably shouldn't be billed together. So for example, if a patient is having a major surgery and the surgeon has to open them up, included in that is that they're going to close them. That's an inherent part of doing that open surgical procedure, is that they have to close the patient. So even though we have separate codes specifically for things like closures, those are all included in that main surgery. We would only bill it out separate if there was some sort of separate area that was being closed. MUEs are medically unlikely edits, so things like the maximum amount of units that you would bill for a service in a day. For example, you only have 2 knees, so the maximum amount of knee replacements one could assumably have in a day would be 2. Now, if you want to effectively use these NCCI edits, there are free resources available through CMS. They give us all of the information we need right on their website with these NCCI edit tables. The tables are updated quarterly and they're broken down into chunks because it's a lot of information. It's basically column listings of CPT codes, and here's this CPT code, and here's all the CPT codes it can't be billed with. And then there's MUE tables as well. So again, all the CPT codes, the maximum number of units that would be billed by the same provider in the same day. Now, there's a lot of awesome software out there, especially our encoder softwares, Find a Code, Codify, Select Coder, that can tell you all the information in regards to these NCCI pairings. And of course, time is money, so if they're saving you time and making this great resource, though, it's going to cost. But you always have those free resources through CMS. They might just not be as fancy and have all the bells and whistles as the encoder software. Plus, with the software, they also have to pay the AMA royalty fees, which I'm not going to get into a rant about the AMA today. But the software makes it really easy. So you can code your case, you can get all the CPT codes you want to bill, type them into your encoder software, and it will go, yep, you can bill all of these together, or this one and this one you can bill together, but only if you can unbundle it with a modifier, or, these two you can never bill together. Speaking of modifiers, one of the key aspects of understanding NCCI edits is understanding the modifiers and modifier indicators. So in the procedure to procedure edit tables, there's a column that tells you if a modifier is or not allowed. And what it does is have these modifier indicators. So a modifier indicator of 0 means no modifier can be used to unbundle these procedures. You are never to put these procedures and bill them together. And a 1 means that you possibly can bill them together in the right circumstances. So it's a separate session, it's a separate location. There's something that's not within the standard realm of this procedure that says, oh yeah, these can definitely be billed separately. So it has to meet those appropriate circumstances. And there is actually guidance in the NCCI edit manual, which we'll talk a little bit more about. And then if there's a modifier indicator of 9, it means that the edit is not applicable or a modifier is not needed. So kind of going back to our closure example, let's say the patient is coming in and they're having an appendectomy. So included in that appendectomy is they're going to open the patient, take the appendix out, close the patient back up. Now, let's say, for example, the patient had a totally separate laceration on their arm. So in that case, yeah, we're going to bill a separate closure for that arm. It wasn't at all related to that appendectomy. So it might say when we put those codes together, yeah, you can bill these together with a modifier. And when we look at our particular circumstances, these were totally separate surgeries that are being done. One is being done on the appendix, one is being done on the arm. We can unbundle those with a modifier and bill them separately. separately. Now, of course, they're going to have separate diagnosis codes as well, but that modifier is what bypasses the system for the insurance company to kind of trigger to them and their edits in their system when they're processing the claim to let them know that this is separate and they should pay for both of these services. In this particular case, we would use a modifier 59 or one of the CMS XESPU modifiers. I have more about those modifiers in this video up here. I'll also link it below if you want to check out the information on those unbundling modifiers. Now, not all modifiers are unbundling modifiers, meaning that not all modifiers can indicate, oh yeah, these are two procedures can be billed together. We're not trying to unbundle a surgical procedure. We can bill these two together. So there's modifier 59, which means it is a distinct procedural service. So one distinct procedure, another distinct procedure again. So the appendectomy would be one distinct procedure and the closure would be a separate distinct procedure, a totally different thing. Modifier 25 is a significant separately identifiable procedure done on the same day as an office visit. So sometimes office visits are built in with little minor procedures and we have to put a 25 on the office visit to let the insurance know, yes, this was a different component not included in that office visit. And then we have like modifier 91, which is for repeat laboratory work. But with all things medical coding, the use of those modifiers has to go back to, is there appropriate documentation to support those services and the usage of those modifiers. Now let's actually take a look at the NCCI tables. I'm going to walk you through a little bit of what those look like. So here we are at cms.gov, and on cms.gov, we're going to go under Medicare and then to coding and billing and National Correct Coding Initiative Edits. When we look at the page for NCCI Edits, there's a lot of cool information here, specifically the How to Use the NCCI Tools booklet. That is a great resource. But over here on the left-hand side is where you're going to find those tables and the policy manual. So very first here is that policy manual, all the information about when we can and cannot unbundle services. And over here is where we have the links to the table information. So we have the MUEs and the PTPs. So down here on the left is our Medicare NCCI procedure to procedure edits. You will find the most recent quarters files here. They are broken down by hospital and practitioner. So if we're billing for the hospital versus billing for the practitioner, and then the earlier versions are here as well. When you look at these, they are huge files. So they're broken down into different segments. There's 4 different files here just for the practitioner versions. So say, for example, I want to check an NCCI edit for a 99214, like what is included in the 99214, what cannot bill with 99214. You're going to look at the ranges that are here for the code that you're going to look up, and 99214 would fall in between these two codes, the 62140 through our category codes over here. So we're going to open up this file. It's going to ask you to agree to the terms of service, basically saying like they're not liable if things go wrong. And once you open that, it's going to come up in a zip file. You're going to open up the zip file, and it might take a little bit of time because it is a huge file. So just be patient. So here's all those column 1 versus column 2s I was talking about, the modifier columns, and then there is actually rationale here as well. One of the first things I like to do when I'm working with these files is I go ahead and I set up a freeze pane so that I can keep all of this information at the top, because otherwise when you scroll, you can't see what's on the top there. So if we click right here and then go to view and then hit the freeze pane, we can keep all that information as we're scrolling through. Now, again, this is a huge chunk of data. Now, I'm sure a lot of you out there are better at Excel than I am and can probably figure out some better ways to manipulate through this data. But for example, let's say I'm going to my 99214 and I want to check that here. What I usually do is I highlight the column A. And again, it sometimes takes a little while because it's a lot of data. And then if I do a Control F while I've got column A highlighted, I can type in 99214 and it will just search for the 99214 in column A. And there we can see here's our 99213s, and then it starts getting into 99214 and then all of the things that are possibly included in the 99214. So here, for example, it tells us 99214 cannot be billed with a 9400
002. Here's the effective date for it. It was January 1st of 2020, and there is a modifier indicator of 0, meaning the modifier is not allowed. You can never bill these two procedures together, or at least not bill them together and get paid for them. And for some of them, it does give you the rationale as well. It says here this one is because there is a CPT manual or CMS manual coding instruction saying what to do. Some of them it says misuse of column 2 and column 1 code, standards of medical or surgical practice. So they do provide some of the information, at least a little bit. You want to go back, of course, to that NCCI Edit Policy Manual if you're debating if you can or cannot unbundle those two codes. If it says a modifier is allowed, you want to make sure that it's allowed in the situation that is documented in the case you're looking at. Now, we also have those MUEs, those medically unlikely edits, the ones that are more so geared towards units. So here's our practitioner services table. We can download that. Again, it's a zip file, so we have to open up the files from the zip. There's the comma separated value and the Excel document. I want to open up the Excel one. Now, this one is already freeze-paned, which I don't know why this one is and the larger file is not. But if we go through, it's again the list of all of the HCPCS codes. This one isn't separate files. It's all just one together. But for example, we'll scroll down a bit. So we'll have the code. We'll have how many units we can bill during that day. There'll be the adjudicator information and then the rationale. So based off of clinical data, based off of the nature of the service, anatomic considerations. So this one's just a little bit more straightforward. I will see sometimes people will try to bypass these by billing them on different lines. That's up to you and your situation and your philosophy of what you're doing if you want to do that. A lot of these codes, for example, are skin-related procedures, lesion removals, grafts, etc., and they do have some max number of units to them, but you possibly could submit the documentation and bill them out on separate lines and do all kinds of stuff to attempt to get them paid.
Staying compliant with NCCI edits can seem a little bit daunting, but here are some tips that you need to follow. The first is to stay updated. Remember, these edits are updated quarterly, so you want to make sure that you are checking the most updated version based off of the date of service that you are coding for. And if something seems fishy in your encoder software, go back and double check it on that CMS stuff, because sometimes those encoder softwares, they miss something or they don't get updated appropriately and they don't reflect what's actually in the information that's given by CMS. Second is use the policy manual. So there is an NCCI Edit policy manual. You can find it on the CMS website. I'll link it below as well. It is the best resource you can find to defend yourself when you're looking at two procedures and going, I don't think we should bill these together, or in this circumstance, we can bill these together. It gives you those guidance of when it is and is not okay to unbundle services. Understanding and knowing how to appropriately apply these NCCI edits is really critical for medical coding, because we want to make sure that we're not accidentally taking any overpayments, that we're being compliant, and that we are being as accurate as possible to reflect the services that were provided and documented. If you have any questions or comments about NCCI edits, please leave them in the comments below. Otherwise, I will see you guys in the next video. And until then, just keep on coding on.